Roots of Health is community-based, and the main thing that differentiates us from some other organizations is that we don't have an office in town. We go to the community that we're working in.
Pwede ba kayong makakuha ng mga galing sa dump site, yung mga straw, ganun? Okay, pero may kumukuha na nun, di ba?
Pulang Lupa is a impoverished and really underserved area, and the needs that the women cite are pretty modest, and in most countries, developing countries, would be considered basic rights. They need food, they need water. They're squatters here, and they don't own the titles or the rights to the land that they live on or their houses. So many of them say that they really want their own land. They want the security of having their own homes, and they need to have jobs in order to generate income.
Sige po ate, so balik na lang kami mamayang hapon. Sige, salamat po.
Since we've been here in Pulang Lupa, we've been really focused on women's health. And one of the biggest challenges that a woman here has is when she has an unplanned pregnancy.
Kaya sabi ko baka pag nag-asawa ako, masipag rin naman yung magiging asawa ko. Mag-asawa na lang ako para sa bahay na lang ako, ganun. Pero ang plano ko talaga, ayaw ko pa magkaanak. Kaso lang, syempre, first time mag-asawa, hindi mo kasi wala, buntis na pala ako. Tapos yun, nabuntis ako kay Althea. Yun, may baby na ako. Tapos yun, gusto ko ipagpatuloy yung pag-aaral ko. Kasi, syempre, kahit paano alam mo sa sarili mo, di ba, yung gusto ko talaga mag-aral pa. Kaso lang, parang hindi rin kaya suportahan ba ng asawa ko kasi nagka-baby nga kami agad. Baka nga siguro kung wala pa, nakapag-aral din ako.
One of the major things that we've been focused on is giving women education and information about their own bodies and about the choices that they have in order so that they can better plan for their future and decide whether they want to have more children or not. And we do think that this is something that will help the families in the long run, since many of the women have said that they already can't support the children that they already do have. So we taught the women about their own systems, their own bodies. We've spent a lot of time talking about contraception, but also talking about healthy pregnancies, about giving birth, about breastfeeding and raising children. We've talked to them about food and nutrition and things like mental health and well-being, as well as things that they can do to try to prevent abuse in their family lives. We've talked to them about violence against women. We're really trying to have a very holistic approach to health.
So, mula nung nandito kami, 12 linggo na tayo nandito na nagmi-meet, di ba, marami tayo na pag-usapan na natin yung tungkol sa physical na kalusugan. Kasama doon, di ba, yung dating sistemang reproduktibo, yung kontraseptibo, sakit na nahahawa sa pakikipagtalo.
When we've talked to the women about their aspirations for themselves, we've found that really most of the time their energies are quite focused on their children. Even when we've asked them, what do you want? Their answers always focus on their children.
Ay, gusto pangarap lang marami. Marami akong pangarap, lalo na yung sa anak ko. Yan, gusto ko talaga siya yung makatapos siya ng pag-aaral. Tapos
kahit bunging yan, okay lang yan. Kami lang nasa harap nyo. Okay, 1, 2, 3, go! May palakasan, may katak, masasayahan sila. Walang ilong, walang buntot, malakas ko tumawa. Oh, bak, 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 oh, bak, 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 oh, ay-ay-da. Oh, bak, 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 oh, bak.
When we first came to Pulang Lupa, we actually didn't have concrete plans to do actual sessions with the children. We were really focused on mothers and women. But we soon found that while we were doing the sessions with the moms, there were all these kids hanging around. And some of them were children of the women in our sessions, but most of them were just kids from the neighborhood kind of watching what we were doing because they were interested and curious. And we soon realized that it really would be a missed opportunity for us not to do anything with all these kids who were just gathered while we were there.
May tatlong palaka, siyan ay mataba. Pero pag lumundag,
They aren't given the attention that they need. Many of them aren't in school. And so we're trying to also help them to kind of gain an advantage and learn some things even though they aren't in school. And we're hoping to also catch some of these kids as they become adolescents before they become another young couple, 16 years old with a child. We also do a nutrition supplement program for all of the kids in the community. And thus far, we haven't been stratifying by age, but we realize that there is some special work that needs to be done with some of the very, very small children, the infants who are under 1, as well as the kids who are under 5. So soon we're also going to be starting to do specialized nutrition supplement programs for those age groups. Our end goal with our work here in Pulang Lupa is really to improve the health of the whole community. And we do feel that when the women are more empowered to make informed decisions about their bodies and their health, that we are going to get to that point where they're going to be healthier, so their babies and their children are going to be healthier, their families are going to be healthier, and pretty soon the whole community is going to be healthier. When we settled on Pulang Lupa, we did so because there was a really, really great need here, and it's a very underserved community. But there are many other communities in Palawan that have very similar situations and that would also greatly benefit from these types of programs. So we do hope in the future to be able to maintain our programming here, but also begin to expand into other communities as well.